Hi, in this video, I'm gonna demonstrate to you how to do a thoracic assessment. So first I'm gonna ask my patient if he's okay for me to do some palpation and movement. So, are you okay for me to do that? Yeah, sure. Okay, so what I'm gonna ask you right now is if you can please take off your top, and then I'm gonna do a quick observation on your back. Thank you. Thank you. So what I'm going to do is a quick observation of the back. And right now I'm gonna have a look at the spine. So I'm looking for scoliosis right now. It just seems to be little deformation here. You can see it here. Otherwise, I'm looking for any abnormalities, and there is nothing major on here. Now I'm gonna have a look at the scapulars on here. So we go on the major border. And then I'm gonna have a look at the superior angle of the scapula, which is normally seated between T1 to T3. So I'm gonna ask you to bend your neck for me, please. And lift up. And thank you. So it's between T1 to T2 on the right scapula here. So then I can take the measurement on here. And if I go down to the inferior angle of the scapula, it should be further away. So that is my dimension. And we are further away. So that is how his scapula is going. So now, right like that, I can have a look at his breathing. So I'm gonna ask you if you can breathe on a medium breeze 2 or 3 times. And I'm just looking if he's breathing with his ribs. Is it moving? Yes, so we can see here it's moving. So what I don't want to see, it's an apical breathing coming by here on top of the shoulders. So now we're gonna move on with the active range of motion. So for that, I'm gonna ask you if you can please sit back and put your knees onto the table. Perfect, thank you. Now, because it's an active range of motion, I'm gonna let him do his movement. So I'm gonna ask you to please cross your arms on your shoulders. Bounce up, thank you. And what I'm gonna ask you if you can put your elbows into your belly button for me. And then you can roll your neck and your thoracic. So we're doing a flexion of the thoracic here, and it was actually flexing. So I'm asking you to go back, say like that for me, and then do it again. So you can go forward, yeah, right here. So when I'm doing the flexion, I can also assess for the Adam test. So what the Adam test is checking for scoliosis. So I can come here and check the spine if he's going straight on it. So you take 2 fingers, you go along, you check for any deformities. Yeah, so it's pretty good with that. So then you can go back to normal. So that was for the flexion. Now for the extension, I'm gonna ask him if you can lift up your elbows for me, please. Look at the ceiling and then extend. So when I'm looking for it here to extend, then when I see the lumbar starting to shift, then I'm gonna ask him to go back to the normal position. What is happening is if here in the lumbar it's shifting, this means I am not assessing the thoracic anymore. So we're gonna do the lateral flexion. So I'm gonna ask my patient with his right shoulder to go deep to the hip. You can do that, and then it's making a C shape, and you can see the muscle on how they're moving. If you can please do on the other side as well, because we always compare both sides. Okay, and you can go back to normal. Now for the rotation, I'm gonna ask my client to turn as much as he can on his right side and to look over your shoulder. And on these 2 armbands, it should be 45 degrees angle. Usually, you can go back and do on the other side as well, please. Great, thank you. So I'm gonna demonstrate to you how to do the breathing. So I'm gonna ask my patient to relax his arm, and I'm gonna place my fingers in the intercostal space, which is here. And I'm gonna ask him to take some medium breaths for me, please. So what I'm looking at is on the both side, he's breathing, if it's quite similar. And he's breathing from the ribs actually. So you can do it for me, please. A bit more. Right. Here we know it can be a bit sensitive. So now I'm gonna check for the apical breathing. So I'm gonna place my fingers interiorly to the upper traps and posteriorly to the scalenes, and then I'm gonna go deep. So what I want to is the first rib to move when he's breathing, and I'm looking for similarities. Yeah. How to do the pivot. So because it's a passive movement, I'm gonna do on my patient. So he's crossed on the chest, and now I'm gonna palpate for the space in between the spinous processes. We're gonna start with the flexion. So I'm gonna bring him, and what I'm looking at is a gate which has to open on flexion. Here it's opening. Now we're gonna do the extension. So I'm gonna ask you to bring this hand underneath here, and I'm gonna bring here in middle. So in this position, my patient is safe. I can do an extension. I can go all the way. So what I'm looking at is the space in between the spinous process to close. Now we're gonna be doing the lateral flexion. So with the lateral flexion, the space will be bending and tilting. Okay. I'm gonna move here. And you can do all the way up, all the way down. And we also can do the rotation. Good. So now we're gonna assess the pavement. So I'm gonna ask my patient if he can face down for me. So we're gonna start with the PACVP. So I'm just standing my spinous process here. Then with this bit of my hand, I'm going on top here. I'm making a C shape with my other hand. I'm applying pressure from posterior to interior. And I'm assessing for the mobility of it. I have to here be fully extended. So now we're gonna do the PACVP. So I found my spinous process on here. We got one, I'm gonna use 1 centimeter away, 1 centimeter on top of it. And then I'm gonna apply pressure. I'm opening my fingers as well. And I'm checking more like for the facet on here. Now we're gonna do the costovertebral joint. So I'm staying on the same side where I'm working. Instead of the others, I was on the other side working. So I found the inferior angle of my scapula here. I found my spinous process, which is in front. I'm going in the middle right here. From this point, I'm going into the middle again. I'm gonna grab my thumb and I'm gonna drag down here like that. I'm gonna demonstrate to you how to do the SLAM test, which is testing for the neural tension. So I'm gonna explain to you how to do it. So you stay seated upright. You bring your hands together, held together in your back, and then you round your lumbar. You still look straight, and then you're gonna round your shoulders while looking straight, and you're gonna straight your right knee, and then you're gonna look down. And then you can dorsiflex your ankle if you don't have any symptom you produced. How are you feeling? Good. So usually you will test both sides. Right now we're gonna just demonstrate one. I'm gonna perform the upper limb neural tension, and we will start with the ulnar nerve. So I'm gonna ask Min if you can come closer to the edge of the table towards me. Thank you. So now I'm gonna grab his hands, and I'm gonna put my fingers onto his fingers, and I'm gonna like extend it. I want his shoulder to be relaxed and flex his wrist. And now I'm gonna bring his hand towards his head. Do you have any symptoms or produced right now? No. So I'm gonna ask you to lift up your head and look away. So I'm looking for reproduced symptoms and also excessive tension, and you can relax. So I'm gonna demonstrate to you how to do the medial nerve test. So my client is close to the edge of the table. I'm gonna put my fingers onto his fingers, and I'm gonna extend his wrist, depress his shoulder, and then I'm gonna supinate his forearm, and then abduct 90 degrees. Do you have any symptoms you produced? Any excessive tension? So because he doesn't have that, I'm gonna ask you to lift up your head and look away. That is one to increase the pain and the symptoms. You can go back. And if you want to decrease the pain and the symptoms, then your client will be looking at you. So now I'm gonna explain to you how to do for the radial nerve. So I mean, if you can place your thumb into your palm, make a fist for me, and then I'm gonna maintain it and flex his wrist, and then I'm gonna drop his shoulder, and then pronate, and I'm looking for an excessive tension or pain reproduced. If your client doesn't have it, I'm gonna ask Min to lift his head up and look away. That's it. And then if he has too much tension, then I can ask him to look at me. And also, depending on where the tension is coming from, maybe I can ask him without the thumb in it. So I'm gonna demonstrate to you how to do the thoracic outlet syndromes. We do have 3 tests. We're gonna start with the Hudson test. So I'm gonna check for the radial pulse of my client. Okay. I'm gonna bring a bit backward his arm. If the pulse is normal, then I'm gonna continue the test. If it's slowing down, then it's a positive test for thoracic outlet syndrome, which is the same right now. So I'm gonna ask my patient to look away and up. Then at this moment, if the pulse is diminished, it's a positive test for the thoracic outlet syndrome. It does mean the brachial plexus and the artery will be compressed. So I'm gonna demonstrate to you how to do the right test. So I'm gonna take the radial pulse of my patient. I'm gonna bring it back. If the pulse diminished, it's a positive test. So on my patient, it's not diminished. So I'm gonna ask Min to look on his assessed shoulder and look down. Okay, so if the pulse is diminishing, it does mean it's positive because the brachial plexus is being compressed. And now I'm gonna demonstrate to you how to do the Bruce test. So I'm gonna ask my patient to abduct his arm to 90 degrees, both of it, extend it, and then flex your elbow to 90 degrees for me. Okay, and I'm gonna ask you to open and close your hands, and you do that for 2 minutes. If the patient is positive, it's because he's not being able to do that for 2 minutes. It does mean the brachial plexus is going to be compressed.